feel about eating bugs? Is it okay if I marry my cousin? What if I don't get married at all? If I can hear spirits, is that weird? Depending on your culture, behaviours such as eating bugs or not getting married might be considered pretty strange. But how do we differentiate between cultural differences and a clinical abnormality? When does someone cross the line from being eccentric to psychopathic? In this course, we're going to look at how we scientifically define, assess, research and treat psychopathology. The term psychopathology comes from the Greek words psycho meaning soul and pathos meaning suffering. The ology part, like all of the ologies, comes from the word logos, which means to study. Psychopathology and abnormal psychology will be used interchangeably throughout this course. So how do we define what is abnormal? Well, the first thing we need to acknowledge is that abnormal is a bit of an abstract construct. It's a bit like trying to define love. What is it? How do we measure it? There's no straightforward answer, and no single definition is going to be perfect in every setting for every purpose from now until forever. And so psychologists use a combination of factors to define abnormality. We'll go over these in a moment. But the general assumption implicit to all of these definitions is that something abnormal is undesirable and some sort of change is needed. The first factor that's considered is the violation of social norms. Social norms are those rules that govern what is and is not acceptable and appropriate in society. When people violate these rules, it may be indicative of an underlying mental illness. But social norms vary widely across cultures, and so defining abnormality solely on this factor would be problematic. One person may be eating spiders because they believe it'll give them superpowers like Superman, possibly indicating the presence of psychosis, whereas another person might be eating spiders because they're a tasty, protein-rich and socially acceptable meal. Now, there are some social norms that are virtually universal, but behaviours violating these rules still may or may not be the result of a mental illness. For example, killing your own child would be condemned more or less globally, but even this behaviour is not necessarily the result of a mental illness. Ancient Spartans have become famous for their cultural practice of abandoning sick babies. Conversely, a mother may have persistent thoughts of killing her baby due to severe postnatal depression, and these thoughts would definitely be considered abnormal even if she never acts on those thoughts. We also can't ignore the role that violating social norms plays in cultural revolution. Eddie Mabo, Rosa Parks, Joan of Arc, those who deliberately upset the status quo for the benefit of society. So what if we could take opinion out of it and just measure behaviours statistically? We would graph the global frequency of all behaviours, and if they fall in a certain range, then they're classified as normal, and if they fall outside of that range, then they're classified as abnormal. This would certainly bring about more scientific rigour, but as we've just seen with leaders of social change, this definition would pathologise remarkable individuals, Olympians, child prodigies, or astronauts, because their abilities fall significantly outside the performance of most of the population. By the same token, mental illness itself would not be considered abnormal in Australia, because nearly half of us will experience some form of psychopathology at some point in our lives. So maybe we should stop focusing on comparing our experiences to other people and just classify abnormality on how distressing the behaviour is or how much it disables the fulfilment of our ambitions. Now, whilst these factors are important aspects in classifying abnormality, once again, there are always exceptions. Someone with antisocial personality disorder may not be distressed when committing murder. Conversely, experiencing distress at the loss of a loved one is definitely not abnormal. Likewise with disability, the binge-purge cycle of bulimia may be severely distressing but may not interfere with a person's everyday functioning at work. And a ballet dancer who becomes a quadriplegic has experienced devastating obstruction to their ambitions, but the physical aspects of their disability are probably outside the realms of psychology. So what do we do with all these rules and exceptions to the rule? Well, the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, takes into consideration a range of factors, including the ones that we've discussed here. The DSM-5 stipulates that psychological disorders involve a significant difficulty in thinking, feeling, or behaving. These symptoms are seen as maladaptive and are usually distressing to the individual or to those around them. These symptoms often impair a person's social or occupational functioning, and whilst these symptoms often violate social norms, they are not solely due to social deviance or cultural differences. Thank you for watching. In this video, we've covered what psychopathology is, different ways we define abnormality, and an introduction to the Diagnostic and Statistical Manual of Mental Disorders. We'll look at the DSM-5 criteria in more detail in the next video, DSM classification and assessment.